During the pandemic, there's been a lot of change and nearly 750,000 American lives lost. As the holiday season nears, COVID-19 cases are once again spiking in some areas, and health experts are urging people to take precautions to keep family and friends healthy as we celebrate together. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about vital things to keep in mind while you're traveling and tips to safely gather with family, friends, and those who are at risk this holiday season. With me today is Dr. Ginny Boos, the Director of Infection Prevention at St. Luke's Health System. Thanks so much for joining us.
Thanks for inviting me, Lindsay.
So, Dr. Boos, as we plan to gather for the holidays, what can we do to keep everyone safe?
Well, in a perfect scenario, everybody would be vaccinated, but including all of your guests. But we also know that we're a very social creature by nature, and in reality, not everyone is. So, boils down to being responsible and selfless, and you know, if you're sick or not feeling well, stay home. If you're the host, then delegate, socially isolate, and or consider rescheduling the event. So it's really all about recognizing the risk and the good old risk-benefit equation. So taking those extra precautions, get tested if you are not feeling well. There's lots of rapid tests in the community. And you would know and, minimize that risk for exposing your guest.
Right. Now, if someone's traveling, what should they think about?
Traveling is another. Are you going to be flying or driving? Again, when people are ill, they should stay home. But let's say if you're flying, then airlines have done a great job of improving ventilation and then, of course, requirements for wearing a mask. If you're cooped up in a car, then, that's your family bubble. So probably likely your exposure is no greater. But then when you're stopping for gas, thinking about, where the places that you enter and wearing a mask. Some communities now have lifted mask mandates. And, I'm not saying that that's right or wrong, but that's a level of protection that is for you, for your benefit. So, again, we want to have people in these family gatherings that are feeling well and not leaving with something that they didn't intend to get.
And now, what if you're hosting a gathering or you're attending a gathering at someone else's house?
Yeah, great question. So, again, like we talked about last year, a host really has a lot of things to think about, not only the menu, but thinking about hand hygiene and making those hand hygiene stations more present in your home. Paper towels instead of towels, just even how we do seating and, think about whether the risk is greater for some members of your family or friends than others. What's the vaccination status and where they've been? If there's some way to improve the ventilation by opening a window, or maybe we'll have good weather and you can host some people outside to minimize the numbers in a room. So it's really, there's no one way to do this. It's really thinking creatively to maximize that, the human interaction that will naturally occur.
Now, with children under 5 not yet eligible for the vaccine and older children still getting shots in arms, what should parents think about?
Again, it's thinking about illness and what their exposures have been. We've seen kind of an uptick in the area with some of the COVID cases. And so, have you had an exposure? If you've been exposed and you're vaccinated, then, maybe taking a close monitoring on that. But again, if you've had an exposure and you're really feeling like you have some symptoms, get tested. With the rapid tests that are now available, you could have some pretty good information, maybe not guaranteed, but pretty good information on whether you are putting others at risk or not.
So what's different about this holiday season from the last?
The biggest difference really is that we have a vaccine. We didn't have a vaccine last year. However, we haven't ever really returned to that pre-Delta, the COVID virus status yet. We still see some cases. that are spiking in the various communities. So the risks are still there, and people that even are vaccinated can still get the virus.
Now, even though community prevalence is lower than what we saw last year, why should we not let our guard down?
Because the virus is opportunistic, and if we see a lot of viruses that are circulating in the community right now. So there's influenza, there's RSV, there's hand, foot, and mouth. There's probably some other respiratory viruses that I'm not even mentioning. So again, it's not just COVID. Holidays are a great time to share, and we just don't want to share viruses.
Well, is there anything else that you'd like to add for those watching today?
No, I think it's, the same old rules apply. There's lots of viruses out there, good hand hygiene, social distancing, get tested, get vaccinated, and stay home if you're sick. Okay, great. Well, thanks so much for joining us. Yeah, thank you. If you'd like to learn more about the COVID pandemic and other health news from St. Luke's, visit stlukeskc.org/news. Thanks again for watching. We hope you stay safe and healthy this holiday season. We'll see you next time on Health News You Can Use.